Hello, my name is Christopher Martinez. Today I will be discussing claims on how glutamine affects the body and whether glutamine is a supplement that should be taken. Some of you who are listening may know what glutamine is, while others are probably wondering, what in the world is glutamine? To start off, glutamine is the most abundant free amino acid in human muscle and plasma. Glutamine is stored in muscles and in the lungs, which where most of it is produced. It is also a naturally occurring non-essential amino acid, which means that it can be made in the body. The following are the claims that have been made about glutamine and its beneficial effects. It increases the rate of fluid absorption, it stimulates protein synthesis, stimulates muscle glycogen synthesis, reduces muscle damage and soreness, and has an impact on the nutritional support for the immune system and prevention of infection, how it helps athletes post-exercise, and how it promotes recovery in critically ill patients. For more rapid fluid absorption, a study performed by Silva in 1998 concluded that the addition of glutamine to oral rehydration solutions increases the rate of fluid absorption above that of ingested water alone. The potential benefits of adding glutamine to commercially available sports drinks have yet to be adequately tested. Even though the limited evidence wasn't adequately tested, if there is any benefit to rapid fluid absorption and retention, it will likely be small. Glutamine can't be adequately tested in commercial sports drink due to its relative instability in solution. Stimulation of muscle protein synthesis and muscle tissue growth. In 2006, Wilkinson saw that glutamine mixed with a carbohydrate and an essential amino acid seemed to limit a rise in the whole body proteolysis during the later stages of recovery. This means that adding any non-essential amino acid to all 8 essential amino acids as a supplement will not have any additional benefits. Therefore, there is no evidence that glutamine alone will stimulate protein synthesis or reduce protein breakdown. For stimulation of muscle glycogen resynthesis, according to Botel, 1999, there is evidence suggesting that glutamine supplements improve glycogen synthesis in the hours after exercise. However, recent studies have found that adding glutamine to essential amino acids and carbohydrates does not enhance muscle glycogen or protein synthesis after glycogen depleting endurance exercise. A study by Wilkinson in 2006 discovered that the addition of glutamine to a beverage containing carbohydrate and essential amino acids has no effect on post-exercise muscle glycogen resynthesis. Reduction in muscle soreness and improved muscle tissue repair. Street 2011 found that oral glutamine supplementation immediately post and for 72 hours after sexual exercise resulted in significantly less strengthness and muscle soreness compared with placebo. Glutamine supplementation in this study attenuated the magnitude of strength loss, improved the time course of strength recovery, and diminished muscle soreness more rapidly in comparison with an isocarbohydrate placebo. Nutritional support for immune system and prevention of infection. Both lymphocytes and macrophages have high rates of glutamine utilization. This allows the white blood cells to provide energy for nucleotide biosynthesis. Your body produces enough glutamine to maintain its regular need. However, during stressful events, your body needs more glutamine. This is because it can't produce the amount of glutamine it needs in order to keep up. Certain medical conditions include injuries, surgery, infections, prolonged stress, all can lower glutamine levels. Since prolonged exercise is associated with a decrease in plasma concentration of glutamine, it has been hypothesized to impair immune function. Athletes who train for endurance events like marathons may reduce the amount of glutamine in their bodies. It is common for them to catch a cold after an athletic event. Some experts think that may be the role of glutamine plays in the immune system. According to Castle 1996, oral supplementation consumed immediately after and 2 hours after a marathon reduced the incidence of upper respiratory tract infection. However, in recent studies, like Gleason 2008, Gleason 2000, and Neiman 2000, they concluded that the glutamine has no effect on various indices of immune function and failed to find any beneficial effects. For the critically ill, the group of Warnerman 2008 performed extensive studies on the safety of alanine dipeptide infused to severely ill patients. In this respect, it was shown parenteral supplementation 4 hours in a peripheral vein on 3 consecutive days was safe and did not cause thrombophlebitis. Patients on continuous renal replacement therapy were also not affected by IV glutamine glutamine supplementation. Since glutamine is a precursor of glutamate that may evoke adverse effects by accumulation in the brain, glutamine infusions to neurosurgical patients were infused. However, the group of Jan Wernerman could demonstrate that even high amounts of glutamine infusions to head trauma patients leaves the cerebral glutamine concentration unaffected. To add on, a more recent study by Andrews 2011, which was one of the biggest ICU trials, clearly found no benefit from glutamine supplementation. To conclude, with the limited evidence that has been provided, it is observed that each study contradicts the other. Glutamine is thought to be safe and tolerated by most people. It is highly advised not to administer to people with kidney disorders. Just like any other supplement such as protein, excessive doses may cause gastrointestinal problems, and you don't really want to be on the restroom for that long. You can usually get enough glutamine without taking a supplement because your body makes enough of it. Even though it's thought to be safe, the bottom line is there's no good evidence to buy or use glutamine supplements. I hope I've provided you today with enough information that will either affect your decision on glutamine supplement or not. Thank you.